Hi, everyone, welcome to my channel where I share with you some interesting facts and tips about health and wellness. Today, I'm going to talk about a common type of skin cancer called basal cell carcinoma, or BCC for short. BCC is a cancer that affects the basal cells, which are the cells that produce new skin cells. BCC usually appears as a pearly white, skin-colored or pink bump on the skin, especially on the face and ears. It is often caused by exposure to ultraviolet rays from the sun or tanning beds. Other risk factors include radiation therapy, increasing age, fair skin, family history of skin cancer, certain medications that suppress immunity, and exposure to arsenic. BCC can be diagnosed by a physical examination and a skin biopsy, which is a procedure that takes a small sample of the skin tissue for analysis. The treatment of BCC may depend on the location and size of the tumor. If left untreated, BCC can cause complications such as recurrence, spread to other parts of the body, and increased risk of other types of skin cancer. To prevent BCC, you should protect your skin from the sun by using sunscreen, seeking shade, covering your body, and avoiding peak hours. You should also check your skin regularly for any changes and see a doctor if you notice any suspicious lesions. Some important questions that you should ask your doctor if you have basal cell carcinoma, or BCC. You should also know what foods can help you prevent or fight this type of skin cancer. So, let's get started. Questions to ask your doctor. How long will the treatment take? Depending on the type and size of your BCC, the treatment may vary from a simple surgery to a more complex procedure. You should ask your doctor how long you will need to recover and what side effects you may experience. How can I tell if it has spread? BCC rarely spreads to other parts of the body, but it can grow deeper into the skin and damage nearby tissues. You should ask your doctor how to monitor your skin for any signs of recurrence or progression. You should also get regular checkups and follow-up tests as recommended by your doctor. How often should I get screened? BCC is the most common type of skin cancer, and having one BCC increases your risk of developing another one. You should ask your doctor how often you should get screened for BCC and other types of skin cancer. You should also check your own skin every month and report any changes to your doctor. Will my family members be affected? BCC can run in families, especially if you have fair skin, blue eyes, or blonde or red hair. You should ask your doctor if your family members should get tested for BCC and what preventive measures they should take. Nutrition tips. Foods to eat. Foods rich in beta-carotene. Beta-carotene is a pigment that gives some fruits and vegetables their orange or yellow color. It is also an antioxidant that can protect your skin from sun damage and inflammation. Some examples of foods rich in beta-carotene are carrot, squash, mangoes, spinach, kale, and sweet potatoes. Foods rich in lutein. Lutein is another pigment that gives some green vegetables their color. It is also an antioxidant that can protect your eyes and skin from UV rays and oxidative stress. Some examples of foods rich in lutein are collard greens, spinach, and kale. Foods rich in lycopene. Lycopene is a pigment that gives some red fruits and vegetables their color. It is also an antioxidant that can prevent DNA damage and lower the risk of skin cancer. Some examples of foods rich in lycopene are tomatoes, watermelon, guava, and apricots. Foods rich in selenium. Selenium is a mineral that is essential for your immune system and thyroid function. It can also help repair your skin cells and prevent skin cancer. Some examples of foods rich in selenium are Brazil nuts, some meats, and bread. Foods rich in vitamin A. Vitamin A is a vitamin that is important for your vision, growth, and reproduction. It can also help maintain your skin health and prevent skin cancer. Some examples of foods rich in vitamin A are sweet potatoes, milk, egg yolks, and mozzarella cheese. Foods rich in vitamin C. Vitamin C is a vitamin that is vital for your immune system and wound healing. It can also help produce collagen, which is a protein that keeps your skin firm and elastic. Some examples of foods rich in vitamin C are many fruits and berries, cereals, and fish. Foods rich in vitamin E. Vitamin E is a vitamin that is essential for your nervous system and blood circulation. It can also help protect your skin from sun damage and inflammation. Some examples of foods rich in vitamin E are almonds and other nuts, many oils, including sunflower and corn oil.